interest in this case would be in nursing. So arts and science learning communities are designed to ease the transition into university by providing our first-year students with extra opportunities to make friends, which is really important in universities, to have a group of friends to work with. And you can study and explore ideas together and work together to develop the academic and personal skills to succeed. There's a learning community called ISAP, and it's for especially Indigenous students. So Indigenous Student Achievement Pathways is what ISAP stands for. And then there's another learning community called Flex, and it's your first year learning experience. So that means a bunch of these students who are taking university for the first time can form a friendship group and support each other. So there's news is that for the 2024 admission year of the Bachelor of Science of Nursing, there's no application fee. So it's usually $90 to apply to get into the Bachelor of Science of Nursing. But this year, they want nurses so bad that they waived the admission fee. So you don't have to pay the $90 to get into nursing this year, but you will still have to pay for tuition. But usually your bands will fund you once you get accepted into the College of Nursing and the Arts and Science program. So these are some of the classes that you'll be taking when your arts and science year of classes, which is also called the pre-professional year. So arts and science classes and the pre-professional year mean the same thing. And it means that you take 10 classes, and they have to be these particular classes. And you may have taken some in high school already, like English and Indigenous Studies, but the first class you'll take is called Anatomy for Nursing, which is Nurse 120. And then you'll take English, and then you'll take Indigenous Studies or History, and you'll take Biology. So it's important to do well in your biology while you're in high school. You'll take Statistics, and you'll take Nutrition, and you'll take Psychology, and you'll take Sociology and the Social Science elective and the Humanities elective. And when you apply for the College of Arts and Science, you'll have an academic counselor who will help you choose your classes, because there's lots of choices in social science and humanities, but I won't go through all of them now. It's just to give you an idea that you need to take at least these 10 classes to get into the College of Nursing. So this is the first year of your life of the nursing program. It's spent in the College of Arts and Science. And remember, you need a 60% average in all those classes I just mentioned to even think about getting into the College of Nursing. So some of these classes are offered online. And I know that in the northern communities that a lot of these classes you can get online now. There's what's called a deficiency class. That means if you're short one class, if you're deficient or short of one class, you can still get into the College of Nursing. So we'll give you time to finish that class. So you could be short, say for instance, you didn't take your Indigenous Studies 107 class in your first year of nursing. You can catch up with it and take the Indigenous Studies 107 or your Nutrition 120 or one of the stats classes that are mentioned here, or Sociology 225 or GE 210 or sociology 112 or nurse 120, or a social science restricted elective. So a deficiency is a course that is not completed by April 30th of the admission year. So a grade of 50 will be used to calculate the average for the purpose of admission. So it's best not to get a deficiency. It's best to take all 10 classes in 1 year and to avoid getting a deficiency class, because it just sets you back a little bit. You can still get your nursing degree, but it does set you back a little bit. So in your second and third year, you'll go to school from September to the end of June, and you'll take all kinds of university classes, which is meant theory. You'll take some labs, so you'll be working in a lab with, sometimes you'll have patients who are acting as, or people who are acting as patients so that you'll practice on, or you'll have mannequins or mannequins to work on. And then you'll have clinical each year of study, so you actually get into the hospitals right away. That's what clinical means, is when you go into the hospitals to work. So simulation is when you're working with people who are acting as patients or with mannequins. And your clinical placements, like I said, take place in the hospital. And some of the courses that include in your second year are, all the classes start with nurse. So you'll take nurse 201, which is perspectives on health, wellness, and diversity, or nurse 203, which is assessment and components of care, and nursing 306, which is exploring chronicity and aging, and nurse 308, which is integrating mental health and addictions into nursing. So these are words you may not have heard before, but nursing has a language all its own. And don't let that scare you, because there's study groups, and there's really good instructors who are going to teach you what all these words mean. And the most important thing to remember is, if you like to take care of people and help people get better, then nursing is a career for you. But these are just the kind of language that you'll be encountering when you get into nursing school. In your fourth year, you only go to school from September to April. And again, you'll be taking university classes and labs, and you'll be in the clinical setting for a few weeks at a time. And again, you'll have simulation. So this guy here, this nurse, he's working on a mannequin, and you'll be practicing on real people too, like giving them their blood, or taking their blood pressure and to their heartbeat, things like that. A preceptorship is when you're under the guidance of a nurse in the hospital, and it can be in mental health or pediatrics or obstetrics or community health or high acuity nursing. And then you'll have to take one restricted elective, which is just another university class. So it's a busy kind of a program. Nursing is, and it's challenging, but it's also rewarding. So some of the additional admission requirements is the Casper test, or situational judgment test, and that's worth 40% of your admission score. And you have to have all your official transcripts from all post-secondary institutions you took classes from. So in other words, the transcripts that you have for your pre-professional year or arts and science year, those transcripts will be sent to the College of Nursing, and they'll look at your marks to make sure you have at least a 60% average or higher to get into nursing. And then you'll have to have an English language proficiency score. But if you've taken grade 12 English, you don't have to worry about that test. And none of you in Wollaston or Fond du Lac or Black Lake will have to worry about taking an English language proficiency test because you'll have taken your high school in English. And then if you're going to get in as an Indigenous student, you'll have to show your treaty card, or if you're Métis, your Métis card. And we put aside 16.6% of our seats are set aside especially for Indigenous students. So you have a really good chance of getting in. Now, this CASPER test I've been talking about is short for computer-based assessment for sampling personal characteristics. And like I said, it's worth 40% of your admission score. And it has to be taken in your admissions year of nursing when you apply for getting into nursing. Once you finish your arts and science classes, you've got to take your CASPER test. And what it does is it evaluates you on your non-academic gifts or attributes and interpersonal skills considered essential for nursing. So it will give you stories or 12 scenario questions for an hour. The test is for 1 hour. And there's 12 stories, and they're about 5 minutes each. And they'll ask you questions on each story. In other words, what would you do if a homeless person came into the hospital and had no place to go to after you finished treating him or her? What would you do? Would you just turn him out on the street, or would you try to find a place for that person to go to? So it's those kinds of scenarios or stories that they'll tell you, and they'll ask you what you would do in that situation. The other thing, in order to take this CASPER test, you have to have your photo ID. So that means you'll have to show your treaty card or your Métis card or your driver's license. And the CASPER test is mandatory, which means everybody has to take the CASPER test in order to get into nursing. And so it tests you on your communication skills and collaboration, which means can you get along with people, work with other people as a team, and how would you solve a problem, and would you treat everybody equally, and your professionalism and your empathy. Would you care for other people, how well you care for other people, and your motivation and your ethics, and in other words, working with people in a good way. So your transcripts in classes, you must submit official transcripts for all university, college, high school courses you've taken, not just the classes pertaining to your application, but applications will be considered incomplete without all official transcripts, and you'll not be offered a seat in the program. So you've got to make sure you do some paperwork and get your transcripts in. But you'll have academic advisors all the way through to help you do this. And you may say to yourself, I think I may have a class already, but I'm not sure. How do I get my class assessed and transferred? So the only way to have the admissions department at the UofS assess transfer credit is to apply to the program. So you can't ask them to look at your records unless you've actually applied to the program already and you send in your transcripts. So foreign degrees, that won't apply to you in Fond du Lac and Black Lake and Wollaston, but there's people from other parts of the world who are foreigners who are applying to get into the College of Nursing. And so they're assessed too. Like I said, you don't have to worry about the English language proficiency test, but people from other parts of the world have to worry about that. So if you want to increase your average to make sure that you're getting to the College of Nursing, then join a learning community. And like I said, a learning community is just a group of students. So probably in high school, you have student study groups already to help you pass your classes. And it's the same thing that happens once you get to university. You join a learning community or create a study group. And there's arts and science learning communities once you get to university. There's learning communities already that you can join, or there's the Indigenous Studies learning community, as I mentioned before. And there's student learning services, and there's tutoring or study groups. So the College of Nursing creates tutoring or study groups. And we do this online too. So theory classes are just university classes. And for example, if you're taking Native studies or Indigenous studies in high school, that would be considered a theory class. So it's just university classes you'll be taking, and then you'll be taking your clinical courses to help you when you're working in the hospital. And then there'll be labs and simulation activities where you're working with mannequins, just like these two pictures. These two students are working on a mannequin in this picture. And some of the clinical environments you'll be working in could be in mental health or pediatrics or obstetrics or community health or high acuity nursing. And there will be at least one placement outside of your home site. So you'll have to leave your home community and go practice nursing in a different community at least once. And the hours of nursing are 12-hour shifts and weekends included. So you'll have to expect to act like a real nurse already. Even though you're a student nurse, you'll be expected to take on 12-hour shifts just like a regular nurse. And you'll be expected to work on weekends already. And this is a picture of Dr. Holly Graham. She's a Cree from Thunderchild Cree Nation, and she's one of the leading, she was a nurse at one time, but now she's a doctor, and she's the Indigenous Research Chair in Nursing. So when I was telling you how much the wages are that nurses make, after they've worked for a few years, Holly Graham would be making a minimum of $60 an hour. Just at the minimum, she's making way more money than that. But the first thing is you've got to have is a caring heart to be a nurse. And then the benefits are, when you're actually a nurse, is that you'll be well off and make a really good wage. And this is some of the research that she does. So some of you may decide you don't want to work in the hospital and you want to do research. And so you work in the university and teach research classes. So this is her research model. So we have what's called the University of Saskatchewan Community of Indigenous Nurses, and that's what I work for. I'm an academic advisor and I'm an Indigenous knowledge keeper, and I work for UCAN, or the University of Saskatchewan Community of Indigenous Nurses. And so we offer all kinds of supports for Indigenous students, like counseling and cultural supports. Like just yesterday, we had a sweat lodge ceremony here in PA for the nursing students and arts and science students. And we have tutoring, and that's what UCAN is about. It's a place for Indigenous students to feel at home in the world. So we offer equity seats, which means that there's special seats set aside to make sure that we're represented with Indigenous nurses. And like I said, we offer academic and personal advising, tutoring, community support, mentorship, peer support, and culturally sensitive counseling. And you can learn in I-La-Crosse or La Ronge or Prince Albert or Lloydminster or Saskatoon. And we're starting up in North Battleford this coming fall, and in Yorkton. So these are all the places that you can go study to be a nurse. You can pretty well do your first year of arts and science in your home community, but the nursing, you'll have to go to one of these 6 sites here on this map. So the closest for you would be La Ronge or PA. And this is a picture of all our campuses where we have nursing programs. So the deadline for applications for the Bachelor of Science of Nursing program is March 31st. So that deadline has passed. You'll have to wait until next year. If you already finished your arts and science program, you'll have to wait until next year to apply into the College of Nursing. But you can apply for arts and science in any term. Now, one thing you've got to remember is once you accept a seat at a site, you can't transfer to a different site. So say, for instance, you applied to go to La Ronge and you're in La Ronge studying, you can't say, I changed my mind, I want to go to Saskatoon. You won't be able to do that because all the seats will be full in Saskatoon. And it requires that all kinds of organization has to be made in terms of finding you a place to work in the hospitals and stuff like that. It's really quite complicated to get things organized for you to get a seat in the site. So you've got to be really clear when you apply on your application program that you're going to be staying at that place for 3 or 4 years. So just keep in mind that you can't transfer. So if you decide to go to La Ronge, count on being there for 3 or 4 years. And now is the time for questions. So you can email us at this admissions to usas.ca.nursing. You can email us there for questions, or you can ask me questions right now. And there's some phone numbers there where you can phone me and ask me questions about the nursing program. So I'll open it up for questions now.
Thank you so much, Kathy McCullen. We really appreciate you here. We've gone over time a little bit, but if the students have any questions, I've put in the email address as well. Let's make sure that undergrad nursing advising at USASC. Yeah, I misspelled it. I've got it wrong. I'll fix it. Thank you very much, Kathy. We really appreciate you and appreciate all of that wonderful information. Um, Students, if you're interested in getting to the university and the College of Nursing, please don't hesitate to let Lorraine know, and Lorraine can pass the information on as well.